Hi, I'm Larry Dillenbeck, and I'm here at Journeys in Salem, Oregon. And I'm here with Vanessa Underwood, who is one of the practitioners here at Journeys. Hopefully she can give us a better idea about the kind of work that she does with her clients and a little bit about herself. So it's good to see you again.
Good to see you too.
So Vanessa, tell me a little bit about how you came to do the work that you do.
I've been in nursing for about 10 years now, and I just wanted to do more. I wanted to help people more, and I felt kind of limited with nursing, so I went back to school and I became a psychiatric mental health nurse practitioner.
I would imagine that there's something about the work that you do that you find particularly satisfying. What is it that you enjoy most about working with people?
I like having a sense of family, and being here at Journeys, it's definitely, a family setting feeling, and it's nice to work with people one-on-one. It's nice knowing that you're working with families, helping either, an adult or a child to get through difficult times.
Right. Yeah, and that's certainly been my experience here at Journeys as well. It's a wonderful, very nurturing environment here. What are some of the particular skills or gifts that you bring as you're working with people?
Well, I have my master's in nursing, so I do the psychiatric nursing, the med management, and it's a matter of just bringing, I guess I would have to say, caring. Because, I think you can't just interview someone, with the assessments and just write out a prescription. It's caring about their lives and what they do outside of here, and really looking for a plan that's going to work for them. And I like the setting here because it's more holistic, and so it's not just me. There's more to it. You have the therapist, and you have the energy healing, and there's just so much more that you can guide people to. It doesn't have to be just about medications.
Right, right. So if I were coming to you for services, kind of walk me through, what would I expect if I were seeing you for assistance?
The first appointment is usually an hour long. We go through an assessment which includes the psychiatric history, it includes social history, medical history, current medications, and it includes anything about suicidal thoughts or thoughts of self-harm. So it's really broadly based in order to get a clear picture, and knowing what other practitioners they've seen or other counselors they've seen, and trying to pull everything together to see what would best fit their needs.
Is there like generally kind of a common goal or an outcome that you're working toward with people?
My goal is to get people stable. I don't want to over-medicate. I don't want to give them so much that they just feel like they have no emotions, but to get them to a point where they can actually feel stable enough that they can work with a therapist or another practitioner to meet their goals. And then as they meet those goals, to slowly back off of medications. Of course, not everyone can come off medications, but the goal is to try to get to the least amount of medications that they would need.
Right. Well, that sounds like a very empowering approach to people, help them stabilize and so that it facilitates other work that they might be doing as well. Is there how long would somebody typically be on medication if they were I would imagine it might change from person to person, but is there some guideline around that?
Typically, if we were talking about depression, the recommendation is keep people on 9 months to a year, and then slowly taper. But it's really individualized. If you can get someone on medication and get them to where they're working with their therapist, and in 6 months they're like, I want to try, there's no reason why not to try, at least to back off a little bit. And if they're not successful, that's okay, because you just put them back on it and keep going, and just encourage them to keep working, because eventually they will get there to where they can back off.
Is there maybe a central message or realization that you would want your clients to come away with through the work that you do together?
I think one of the most important things is just knowing that, one, you don't have to be on medications forever, that happiness doesn't come in a pill, You know, happiness really, they have to seek that within themselves and decide what their goals are and what they want to work for. And really that's the biggest part, is loving yourself, caring about yourself to do the right things, and knowing that medications is just a bridgeway to health. It's not an absolute. It's just a way to get them where they want to go.
Anything else that you would want people to know about either you or your approach to working with people?
To not limit themselves to just counseling or just medication management, to know that there's other, you know, energy healing, there's massage, there's acupuncture, there's so many different avenues that they can approach their issues with, and not to be scared to experiment and try, and know that from this base where they're coming into Journeys, that they have a base of safety to go out and explore, so that they can find what really works for them.
What would be like your evidence for success? How do you know that you have achieved your outcomes with a client?
It's really based on their responses. You know, if they come in and say, I'm feeling great, this is really working for me, you know, when their depression is under control or their anxiety is being managed, then I know we've gotten to a point where they can really work from. If they're coming in and they're saying, I'm still so depressed, I'm having a hard time getting out of bed, or my anxiety is so bad I can't leave the house, then we know we have some work to do. So it's when they get to the point where they can say, I'm feeling really good about myself, and we have their depression or anxiety or whatever it happens to be that they're working on, to where they're happy with it, then I'm happy with it. Because it's really centered totally on the client, on what their perceptions are.
Right. Are there any risks or challenges that you think would be important for people to be aware of when considering med management?
There's always side effects, you know, and I think it's really important not only to ask your prescriber what they are, but also to research yourself, and so you can ask questions if you don't really know what they might be. But it's also important to always take them as prescribed. If you do have side effects, get a hold of your prescriber and say, this is happening, I'm not really sure if it's med related, and then that way you have a conversation with one another that you can help figure out exactly what it is that's going on.
What do you see as like your next step or your next level?
My next step is, well, for me, it's just growing spiritually, is to continue to better myself, you know, because everyone has emotions and needs that they want to work on to be better. It's just to keep growing and just to incorporate that more and more into what I do as far as being a med manager, and then yeah, it's just growing more and not stopping.
Right. Well, that's I think something that we can all aspire to.
Yes.
And just keep growing, keep expanding, and it's nice to have people that we can go to help us along the way and to go further on that journey.
Yes.
So thank you so much for sharing that with us today.
Thank you.